Hi, today we'll be talking about the role of the Minister of Health during the COVID-19 pandemic, control and prevention. And this is going to be prepared for the general public. So first, we're going to go over the case report. We're going to go over an overview of the Ministry of Health, COVID-19, and then talk about the Ministry of Health role in terms of control and prevention. We're going to go over final recommendations and limitations. All right, so for our case study, on December 31st, 2019, China recorded a cluster of cases of pneumonia in people associated with a seafood market. On January 7th, 2020, health authorities confirmed that this was the novel coronavirus 2019-nCoV, which we now call SARS-CoV-2. Although cases were originally reported to be associated with exposure to the seafood market, current data indicates that person-to-person transmission is occurring, and as of January 30th, 2020, there are almost 10,000 cases in at least 21 countries, including the first case in the US. As of April 24th, there is 2.7 million cases with over 194,000 deaths in 185 countries. And then as of June 5th, there's over 6.7 million cases confirmed with over 393,000 deaths across 210 countries. So this is where we're going to pick up in terms of the Ministry of Health actions. So just as an overview, in the country that I'm presenting on, the Ministry of Health is part of a federal system. So it's a standalone government body. It's going to set the health policies and work with the Prime Minister during health crises. So what that means is that the Minister of Health, myself, will give recommendations based on current knowledge to the Prime Minister, but the enforcement and guidelines setting is going to be up to the Prime Minister in the end. Another thing, we're talking about budgets and resource allocation. So this Department of Government is funded through taxes, and the Congress sets the budget for the year. During a crisis like this, we would have legislative action in order to create separate funds for crises. And then also we're going to have separate regions like states or provinces, which we will have oversight over. In terms of the citizen benefits and our pricing models, the Ministry of Health is going to provide the national healthcare benefits for all the citizens and determine the healthcare provider reimbursement rates. And then also, again, during these crises, we'll have the ability to create special entitlements. So what that means is that we have special funds for the healthcare workers in order to ensure that they are properly reimbursed during a crisis like this, where we need a lot of HCPs. In terms of our health strategy and human resources, we create the National Comprehensive Health Strategy. So just annually, we go through, we decide what's important for the year. Obviously, for this crisis, it's going to be very specific. We also provide teams of professionals for the regional health needs. So if there's any type of foodborne outbreak or environmental outbreak in any province or state, then we go ahead and send a team of scientists, epidemiologists, enforcement officers to that region to help the regional government with that. We also create health promotion. So this is going to be probably the most important part of the Ministry of Health in terms of a citizen focused endeavor, is creating the health promotion that the people see. So there's going to be radio, television, film, calling, pamphlets, all going to be towards our strategic goal for the year. And then obviously in a crisis like this, we're going to have specific messaging, which we'll go over in a minute. And then also, very important topic for the Ministry of Health is research in environmental diseases, our foodborne diseases and infectious diseases. This is going to be our basic research, as well as research into specific items that affect the nation. All right, as for this outbreak, the COVID-19, Again, we defined it as SARS-CoV-2. That's severe acute respiratory syndrome, coronavirus 2. This is going to be in the Coronaviridae family, along with the common cold, which most people know about. And then we also have SARS and MERS that have previously arrived. These are all going to be, the coronaviruses are natively bat in the bat reservoir, and then they are able to spill over into other species, and then sometimes spill over into the humans. And that's what we're looking at here. The virus is a single strand positive sense RNA. It's enveloped, so it's not extremely hardy in the environment, roughly 30 kilobytes, and highly mutable. So this virus has exonuclease activity, so it can repair itself, and it also, again, is highly mutable. So there can be a lot of variation as it spreads through a population. The spike protein is going to bind the ACE2 receptor, and that's how it infects cells. A big part of its attack would be suppressing interferon release from the cells. And there are major variants. We start with alpha, beta, gamma, delta, and Omicron are all major variants that we've seen thus far in this outbreak. And then COVID-19 is what we call the disease. Currently a global pandemic. It has an aerosolized spread, can also be spread through wastewater. So what happens is the epithelial cells in the respiratory tract and the gastrointestinal tract express those ACE2 receptors. So those can be infected by the virus. What you end up with in inflammatory dysregulation and cytokine storm. It can be a 3 to 14-day onset, variable resolution. You can have a loss of smell, a loss of taste. There's a lot of variety of different symptoms that a patient can present with. So our role in the control and prevention of this outbreak is, first we're going to talk about control. We're going to have surveillance. So all of the doctors, all of the hospitals are going to report back to us in terms of how many cases we have, positive and negative cases, so we can keep always keep that like percentage of current infections based on the number of tests. We're going to have free testing. So this is going to include accessible clinics. We're also going to send out home kits to all citizens so they can test themselves. Social distancing. Again, like the Prime Minister is going to have the final say in what enforcement we can have, but I'll work with the Prime Minister in order to enact social distancing guidelines, restrictions of the movement of people. We'll have curfews with road checkpoints at night, and require mask wearing in public. This is all going to just help reduce the spread of COVID-19 by reducing the interaction of the people in our communities in this nation. We're also going to restrict the travel into and out of the country with required testing in and out of the country. And again, the free testing we're going to have for everybody. And then in terms of health promotion, we're going to create a strategy and a comprehensive health promotion for all the above tactics. So in terms of surveillance, we're going to have outreach towards the HCPs in order to let them know what information we need. For the citizens, we're going to have a large outreach campaign letting them know about the testing, the importance of it, the importance of social distancing, and just all of the facts about the virus that the public needs to know. In terms of prevention, so control and prevention have a lot in common. We're going to create a pool of funding to develop and roll out the vaccines. We're going to fund research into the virus in addition to the vaccine research. We're also going to enforce all those guidelines that we set in the control section on the last slide. And we're going to try and create legislation to legitimize this crisis and set the overall response strategy for the nation. We're also going to enable the regional public health authorities to enforce guidelines specific to each of their regions, depending on the level of vaccination and infection in their region. Again, health promotion is going to be our major, our key point here in talking to the public, we're going to create a broad media campaign. Again, radio, television, film, pamphlets, even calling the citizens in order to align the public with our strategy in fighting this disease. We're going to, again, encourage that social distancing and mask wearing. We're going to need to reduce the spread of information by having very clear and concise information to give to the public. We're also going to show support for healthcare providers through health promotion. That's going to let the citizens know that we care about our healthcare providers and help let the healthcare providers know that they are very appreciated. We're also going to ensure the citizens and the healthcare providers have proper resources for mental and psychosocial health. Since we're going to have these travel restrictions, that is going to be a problem financially for some people. It's also going to be a problem in terms of people will be home more and there can be an increase in domestic violence. So we want to reduce that by having proper mental health resources, as well as any hotlines that anyone needs to know about if there are conflicts in the home. And again, we're going to create a fund in order to offset some of those costs that the citizens will have because of the social distancing, the quarantine, the travel restrictions, just so that they can stay on their feet because we want the population healthy and productive. So again, our final recommendations, we're going to try and beat COVID-19 by funding research, creating vaccines, social distancing, having those travel restrictions, financial and mental health assistance, as well as, again, our major point is health promotion. And we're going to coordinate with the international community in all of these endeavors. Some of the limitations that we might find, we might have some friction with the executive branch in terms of the guidelines and enforcing those guidelines. Misinformation is always going to be a big concern that we'll have to fight. We could have pushback from the public because of the social distancing and other guidelines. Also could have pushback from the public in terms of vaccination. We might have a lack of financial resources given by the Congress to fight this disease. That would be problematic. And then since we have authority in all of the regions, there could be some friction in terms of coordinating the response with our regional entities. And here are my references. And thank you for joining me today.